Why is healthcare so expensive in America?
On average, I think it's about $15,000 per person
Really?
per year.
Wow. Right. Are we getting a better outcome?
We're not necessarily getting a better outcome compared to other countries. Sometimes it's about helicopter,
Right.
and that I think it's about $30,000 per transfer.
That's an expensive ride.
Now, that is ironic because the US spends more than anybody on drug research. However, the recent surge in AI technology really gives me hope.
Welcome to another episode of the SpeechSage AI and Healthcare Podcast. I'm Noah Vandal, and I'll be your host. And today we have Dr. Joseph Yoon, and we're going to be asking him a few questions about healthcare. And the first question I have specifically is, why is healthcare so expensive in America? And I know that's a huge question, but yeah, what are some of the numbers and what are some of the things that you have seen in terms of expenses in healthcare?
Yeah, so the U.S. spends the most in the world, entire world, on healthcare. On average, I think it's about $15,000 per person per year.
Wow.
And when we compare that to other industrialized countries such as Europe, it's about 100% more. They spend about $7,000 to $8,000 per person.
Interesting.
Other Asian countries, I think, spend less. South Korea, and they probably spend about 1/3 of the U.S. So that's one problem. But the other problem is that what are we getting for spending more?
Right. Are we getting a better outcome?
Right. So that's the why people are thinking that the U.S. healthcare has a healthcare cost problem, because we're not necessarily getting a better outcome compared to other countries.
Sure. Well, I guess with that being said, so when it is so expensive, where's all that money going? If we're not getting better outcomes, it's obviously not going directly to the patient, I'm assuming.
Mm-hmm. So the number one cost within U.S. healthcare is hospital. I think they spend about 31% of the total expenditure.
Sure.
And second item is clinics and physician. They are about 21%.
You're saying them like the units as a whole, though, not the
Yeah, out of the whole pie, 100% U.S. healthcare expenditure, 31% of that pie goes to hospital care costs.
Oh, sure.
Yeah, and that includes a lot of different things. And it is true that in my experience, hospital care cost has gone up quite a bit past 30 years.
Sure.
And some things are for legitimate reasons. When I compare my experience as a physician 30 years ago versus now, we do so many more things.
In a good way?
Yeah, in a good way per disease entity. So, for instance, my heart attack. We used to just use just some one or two medications, and then admit the patient to the hospital floor and just watch.
Wow. Okay.
Whereas now, if you have a heart attack, time is of essence in terms of doing different interventions, such as getting patient to the cath lab, where they can do angiography to look at the blood vessel within the heart and fix it by removing the blood clot that is blocking the artery.
Yeah.
Versus expensive medication to bust the clot.
Sure.
Then subsequent stay in the critical care unit and that is highly specialized with highly trained nurses and physicians.
That makes sense.
Yeah, so on average, that type of highly specialized intensive care cost about at least $10,000 per day. So it adds up very, very quickly. So for those, that is one part of the very legitimate reasons. Then also compared to 30 years ago, we also do a lot more imaging in the hospital, such as
Like
MRI
okay.
or CAT scan, ultrasound. In the old days, X-ray was all we did, and a physician had to try to guess as to what the diagnosis might be.
That makes sense.
Now we are much better at diagnosing the disease entity with the help of a lot of different diagnostic imaging.
Sure. Interesting. I had a 9-year-old just the other day. I don't know how it came up. We were talking about heart attacks. And he said, if I had a heart attack, I would just attack it right back. And I was like, okay, if only it was that easy.
Yeah.
But
so a lot of, we use the term heart attack.
Myocardial infarction.
Yeah, but it is the blockage of the heart artery that prevents a blood flow. And
maybe you can attack it, but just dislodging whatever blocked it.
Right.
No. So one thing, though, along those lines, I saw a chart, or data, and it was about with regards to the U.S. increase in healthcare costs over the last few decades. And one thing that was really notable from that was, okay, yes, we have more improved MRIs and all these different things, but kind of what you already alluded to, the clinicians and the nurses, a lot of, only 8% of that growth can really, 8 to 10% can only be attributed to an increase in salary for the clinicians and to the nurses. A lot of it was, some of it was, more imaging, that type of thing, but a lot of it was administrative.
Yep.
So I'm curious, what have you seen in terms of the administrative bloat and what can be done? How big of a problem is that?
Yeah, so compared to, I think 30 years ago, the definite change in healthcare system is that healthcare system has gotten a lot bigger. Not just the not just the number of procedures and all that, but the organization itself.
Really?
30 years ago, you would see commonly physician-owned clinic, physician-owned practice, and hospital was an independent entity. All the clinics, like specialty clinics and imaging centers, were all independent. Now what we see is a big conglomerate, big corporate entity having the very extensive system. On one hand, that enables better coordinated care. Because they're all under one management.
Right. Yeah.
So people communicate better and share resources better. And also they are able to counter the expensive equipment or resources.
It was kind of a little bit of a sunk cost.
Right.
It takes a long time to recover, I think, right?
Yeah. So, and then they are able to invest better. So the MRI costs quite a penny, and the individual physician practice may not be able to afford, whereas a big system is able to finance it and acquire it. But then there is an incentive to recoup the cost, and that inevitably goes into the calculation of purchase decision at least. And some people argue that also incentivized overutilization on the part of the large system to use that. I think consciously, I think people within the system really try to make the judicious use of resources like MRI.
Right.
But then I think it is it might be a underlying incentive that is also in play as well. So that contributing to the rising medical cost.
I suppose too. Do you think there's any sort of the free market playing in where if you have less competition, there's less incentive to reduce prices?
Yeah. So I think I felt that firsthand.
You did? Okay.
Yeah. So I practiced in rural area of northern Minnesota, and then Twin Cities, and then South Dakota. Very interestingly, my healthcare costs, healthcare insurance premium was the lowest in the Twin Cities.
Oh, because there's more competition.
Yeah.
Yeah, okay.
I mean, I don't know what the market situation is like, but I think
Sure.
my guess is that there was more competition in the Twin Cities because it's larger and more players.
Makes sense, yeah.
Compared to the South Dakota and northern Minnesota rural areas.
And ironically, probably better care as well, just because there's more resources.
Yeah, that's the irony. And I think everyone is recognizing the disparity between the kind of rural care and the urban care in terms of level of resource availability and thus affecting the ultimate outcome and quality.
Sure.
And that is one of the big the problem that I think everyone, including federal government, is looking at. And thus recent Big Beautiful Bill specifically allotted I think $50 billion to rural healthcare transformation.
Because they see it as a need.
Yeah, and I experienced it firsthand. But it's not just the rural healthcare. It inevitably becomes expensive trying to deliver modern medicine because of a lot of modern medicine. Let's say MRI.
Right. That's not cheap.
Yeah, it's not cheap.
You're probably not going to install one in Lennox.
Yeah,
right?
And your payment from insurance company is not much higher than urban area, right?
Right.
So then you have to maintain the imaging center with a smaller population.
Right.
So that already is a challenge. So inevitably, the efficiency of recouping the cost will be much more challenging than the urban area. So the unit cost then is likely to increase.
Right.
So I could understand that also, why rural medical expense is higher, but also transport too. A lot of times we have to transfer patients from a rural hospital to urban hospitals, and sometimes it's by helicopter.
Right.
And that I think it's about $30,000 per transfer.
That's an expensive ride.
Yeah, so it's not cheap, and that all adds to the rural healthcare, and that's why I think the bringing the specialty tertiary care to rural community is what's really necessary to improve that situation. And technology such as utilizing telemedicine could be one way, but the AI, I believe, will be a very, very important component of improving rural healthcare by bringing the expert level knowledge and analysis to the clinical care in rural community.
Right. Well, we were talking about this the other day. And you were saying, the problem with MRI is, yes, you can be more detailed than an X-ray, but maybe an X-ray is sufficient and the clinician is maybe lacking in judgment, or maybe the X-ray has the information necessary, but it needs to be extracted by an entity like an AI that is trained to be able to find
Yep.
those details that like a great clinician would still miss,
Yep.
right?
Mm-hmm.
Yeah, okay.
Yeah, so that's by the virtue of AI being able to have access to so many more cases.
Sure. Oh,
So,
yeah, because the
yeah.
doctor can only see, what, a 10,000 in their lifetime?
Right.
Maybe.
If I see 10,000 X-rays, that's a lot.
That's a lie. Time for bed.
Right. But the AI have access to millions and, of imaging.
Right.
So they are able to process it, in a way that retains information better than human memory.
Sure.
So I think it is not. I mean, it's understandable that the AI has or will have better capability than human physician's interpretation of imaging, for instance.
Sure. That makes sense. So that's kind of more the admin side. Quick pivot, like what do you think of the medication side? That has also not gone down in price. What's the reason there?
That is one of the major differences between healthcare 30 years ago versus now.
Is what?
The number of medication that we have, we use and available,
sure,
has gone up exponentially.
Well, it's drink more water, right? It's more than just that, right?
Yeah. So the along with that is the rise in chronic diseases such as diabetes, hypertension, and
Sure.
Heart disease and all that. That necessitates ongoing maintenance with the medication administration, and also a number of medication that's available to treat has gone a lot. So, along with that, the cost that we spend on medications have gone up.
Sure.
Now, the complexity of managing medication has gone up a lot. And so, as a share of healthcare cost, it's about 8 to 10% of a healthcare cost. But that's a lot more. Yeah. In America, we pay more per medication usually than other countries, because and I think it may be changing, but when Medicare D was enacted, the Congress explicitly prohibited CMS, Center for Medicaid, Medicare, prohibited from negotiating drug prices with pharmaceutical companies.
That got redacted later, I think, right? A few years ago.
Yes.
Yeah.
So
I think that was probably a really bad policy.
Yep.
Yeah.
But until now, that has, I believe, contributed to much higher cost of medication in the U.S. compared to other countries where the governmental entity, which represents the country's insurance, will negotiate price down.
Sure.
Now, that is ironic because the U.S. spends more than anybody on drug research.
Right, we're the ones making most of them, it seems.
Yes, so it's very ironic that we spend so much more out of our tax dollars on researching drug development, and yet we're not getting the benefit of that cost, but pay even more than other countries on drugs.
I've heard on that specific aspect, people have said that's because the R&D of these drugs are kind of priced in, and so we end up eating the costs up front because we are the developers as well.
Well, but if we are financing those researches through NIH grant and all that, our tax dollars, shouldn't we get some?
You'd think so.
Some return,
right.
So that have other countries pay for the investment that we made through tax dollars.
It makes sense. I don't know what the solution is for that necessarily. So I guess with all that though, I mean, how do you see AI as being a really helpful player in managing this, or at least maybe bringing down some of the costs?
Right. So one example would be medication adherence.
Okay.
A lot of times,
Sure.
patients don't take medications as they are supposed to.
We talked about this.
Right.
Yeah. Yep.
So through AI, if we could educate patients and have a reminder, if we can increase the medication adherence, then we can prevent disease progression at early stage,
Right.
so that they don't need many more medications in the late stage. So that's one way to help keeping people healthy and reducing the healthcare cost.
Sure. Okay.
Because the hospital care is the highest cost in the U.S.
Oh, by far.
So
Yeah.
whatever we can prevent hospitalization can reduce the healthcare costs. So by prevention, concentrating on prevention, using AI in a lot of different ways, so that if we can prevent hospitalization rate, then we can ultimately reap the benefit of healthcare cost reduction through AI.
An ounce of prevention is worth a pound of cure type of thing.
Yep, that cannot be truer in the U.S. healthcare, because, in my opinion, and also other people's opinion too, U.S. healthcare is too acute care centric.
Right. Yeah, everything's on that part.
Yeah, and that's in a way reflected in our cost amount in hospital care.
Sure.
We are very good at taking care of people when they are sick, but we are not nearly as good in preventing chronic disease from happening, and really concentrating on chronic disease prevention so that we can reduce the hospitalization.
That makes sense. Any final thoughts or comments?
Yeah, so when I think I'm very hopeful. So there has been a lot of discouraging moments in my career as I see healthcare costs going up and up.
Sure.
And not necessarily in an efficient way. And I think that's reflected in our not necessarily a better outcome compared to other countries. So in some sense, we spend a lot without the better outcome. So I've been very discouraged in the past 30 years, a lot of ways, because I felt like as the system, we are not concentrating enough on preventive care,
right?
And we're not using utilizing the system efficiently. However, the recent surge in AI technology really gives me hope. And that finally, perhaps this is the technology that we can use really to reduce the cost, eliminate the inefficiencies, and yet have a better outcome.
Sure. Well, thanks for your time, and it was great talking with you and learning more about what your thoughts are on this. So thank you.
Oh, thank you for having me.